All right, good morning, everyone. This is the Random Moment Time Study portion of annual training. Really glad that you could join us today for the virtual sessions. And I think we've gone over all of the housekeeping stuff, so we can just do some really quick introductions. I'll just kind of go around the room. We have John Ward here from PCG, Rose Jensen, Lori Bob, Andrew Jelinski, Jennifer Pham, and Matt Gillis. We also have Omar Estrada from CDE, myself, Olga Genshin from the department. I'm the School Health Services Administrator, and we also have Tracy Gonzalez from the department. We have participants across the state, and we again appreciate all of your attendance here today for the Random Moment Time Study portion of our annual training. And I think with that, I can hand it over to Rose, who's going to kick us off with the first slide. Thanks, Rose.
Great, thanks, Olga. Welcome, everybody. I see some repeat people in the audience today, some that which we had in training, so I love it. Just getting some additional information on RMTS. So let's kick it off here. This is what we're going to talk about today. We're going to touch on happenings in RMTS. We're going to do a couple of activities, and we are going to have, I do believe we will have time at the end of the presentation to answer any questions you may have after the session today. Okay, so first couple slides are your acronyms. We do like to put these in here for you to refer back to. I will do my very best to not speak in acronyms today. I will try to, if I say an acronym, I will try to speak it out fully if I remember it. There's a lot of them. So with that, just know that's there for your reference if you're checking in on this presentation sometime in the future. So before we kick it off with RMTS, we're just going to go back and do a little bit of a Medicaid and schools overview. We do have some new folks joining our program this year, and it can't hurt to have a refresher. So we're just going to talk a little bit about that on the next, on this slide, and then some roles and responsibilities we play for the program. So what we've done here is just sectioned off Medicaid and schools by each entity. So we've got the federal government, the state government, and then you guys as the districts or BOCES, and the parts that everybody plays in Medicaid and schools. So the federal government, we often refer to them CMS for Centers of Medicare and Medicaid Services. They really offer the guidance for the program. Kind of loosely, they set them, and then they send the details out to the states, and then the state healthcare, or excuse me, the state Medicaid agency then tailors the Medicaid and schools in the SPA, which is the state plan amendment, to really tailor it towards the needs of Colorado. And that state Medicaid agency, as you probably know, is the Department of Healthcare Policy and Financing. And we'll just refer to them as the department. So you've got your federal government providing the oversight. They also had the Individuals with Disabilities Act, which hopefully you have heard of, which requires you to provide the students with disabilities FAPE, which is the free and appropriate public education. So these are main things driving Medicaid in school. And then also just the federal laws that say that Medicaid agencies are responsible to pay for the direct services provided to students on IEPs, and it should say other plans of care now with the expansion of free care, and as well as the administrative costs and support of Medicaid, which is outlined in the state plan that I referred to. So we talked about the department's role a little bit as well, as far as providing the policy specific to Colorado, in the program, that'd be the SPA, the time study implementation guide, all that stuff is what the department works on and then sends to CMS for approval. And then we have a fully approved plan that we can move forward and administer, which is what we've been doing for the last, I don't know how many years, 12, 15, longer than I've been part of the program. So also just a reminder that your reimbursements, they come from the department. They're the ones sending out your interim payments. They send out your MAC payments, and then they send out your cost settlement. And then you as the district should know that you have to sign a participation agreement to participate in the program. And you have to, of course, abide by all the compliance pieces of the program. So let's talk a little bit about program support and what that looks like. So we talked about the role of the department, how they write the policy for Colorado, enforce the CMS guidelines once they've been approved. Training and administration, like why we're here today. They run the training program, put it all together logistically for us. And then of course they approve and deny any RMTS and cost reporting types of extensions that you may have when you're trying to meet your deadlines. The partner of the department is the Colorado Department of Education, so CDE, and they are a partner for spending the money that you are reimbursed for in this program. So you fill out the reimbursement spending spending report for them. You also do your LSPs through CDE. So that's how they play a role in the partnership. And then Public Consulting Group, which is who I'm with, we are the vendors to the department. So they employ PCG to basically do the day-to-day administration of the program for you, to the districts. We provide that help with the inquiries that come in through the help desk, whether you're calling, emailing, providing a web ticket through our system. We're also that software vendor, so we provide the system where the random moment time study takes place. And then of course, that's also where we house all the costs that you guys report, which kicks off claiming. And then very important piece as well is the stakeholders. So some of you on this call are stakeholders. We have experienced regional coordinators who participate as stakeholders, as well as community partners like your billing agents, which we'll talk about on the next page, on the next couple of pages as well. But basically, it's just a great community of folks who have expertise, some more than others in specific areas, but then that come together and really share that knowledge, provide feedback to the department, and really work together in partnership to help make the program successful. Okay, so let's talk a little bit about program roles and responsibilities. We actually kind of covered a bunch of them for the department and Public Consulting Group. So we're going to skip forward to the Department of, well, I actually covered CDE as well, but let's talk about the billers. So the billers, some of you do self bill, but most of you do employ a billing agent to help you with those needs. And there are several that participate in this program as your vendors. And so much like PCG is the state vendor with the department, the billers are employed by you, the districts, and the BOCES. And then of course, the roles that you're probably most familiar with are those district and BOCES roles, as far as entering into an agreement to participate in the program, and then all the things necessary that you have to do to manage your program are kind of listed here. So you come to these trainings, you manage your time study, you report costs and all that good stuff. You stay compliant, keeping your documentation and all that other good stuff you're pretty familiar with. Okay, before we jump into RMTS, just want to pause. Any questions about just sort of Medicaid in schools and our program, the School Health Services program, just in general? You can also throw them in the chat. I think Olga put something in the chat. Feel free. All right. We'll field those as they come in. Let's jump into RMTS. So what you're looking at here is the statewide direct medical percentages. They are broken out by quarter. This is your direct service cost pool direct medical percentages displayed here. So in the top yellow line, what you're looking at is the direct medical percentages that your providers, your direct service providers, are providing to students. And the bottom one is that free care percentage. So as you know, when we implemented free care a couple of years ago, that is now an additional piece of reimbursement that you get through the expansion of that piece of the program, which is great. Because if you're looking at the top line here in yellow, which has traditionally been the reimbursement that is applied to your cost settlement on your annual cost report, if you're looking at that yellow line there, you can see it has fluctuated since the start of the pandemic. We saw a dip, very understandably, as a lot of your providers weren't in school in person providing those services. So we saw a sharp decline there, but we have seen it start to bounce back little by little the further along we get in the pandemic. And so I think that's much explained in this trend line as well. There's a slight dip in AJ22, which is the quarter you just most recently finished. You can't really see the previous AJ quarters from years ago on this slide, but just know that that is normal. We do usually see a slight dip in AJ22. Those are also not finalized yet. They are still in review, but we don't anticipate there being too much change there. And then the free care on the bottom, really just 100% new since OD20, a reimbursement that you never had before. So that was really the timing of it. While it was hard to implement during the pandemic, the timing of it is such that it's sort of, because you were getting that additionally, it sort of offset the dip in your direct medical percentage that you saw from the pandemic. So any questions or thoughts on that, throw those in the chat. We can revisit. We're going to keep pushing forward with more time study percentages, but also just wanted to mention one thing. These percentages, because they're direct medical percentages applied towards your annual cost report, they are aggregated for the fiscal year. So there's 4 quarters in the fiscal year. We run the time study 4 quarters, and then we aggregate run the time study 3 quarters, but we aggregate those percentages and apply them as one percentage for the fiscal year to your annual cost report. We just break them down like in quarters here so that you can see how each quarter is responding and looking, because that's how they're collected from the time study.
There's a question for the department in the group chat right now, Rose.
Okay. I won't be able to manage the chats just because they pop up on my screen. So,
Joseph,
oh, go ahead.
Yeah. Joseph is asking, given the NG audit findings by OIG agreed upon by CMS in March of 2022, what is the plan to include moments during the summer months? Also, what is the plan to obtain parental consent from the entire school population? I feel like that would be geared more towards HCPF, if I'm not correct.
Yeah, so I'm happy to answer that question. So what is the plan to include moments during the summer months? We are not going to proactively change anything unless we're asked to. So there is no plans to change the current structure of the random moment time study. And Joe, could you maybe come off mute for a second and
I'm off mute right now.
The parental consent, what that's related to. If you could just, and maybe Omar can pop in on that one.
Sure. And if you want me to explain, I'm just curious because the finding has been out there, and I just really, I understand CMS has not put a new directive out yet, and whether they're going to or not, they said they're going to. Who knows? And we also know that they don't want to get political with it. So I'm not quite sure what the plan would be, but I also know that there's a problem with this, and I was hoping that maybe you guys could shed some light on it.
Yeah, and it's not related to Colorado. So we wouldn't do anything unless we were specifically asked by CMS to change our structure, and we haven't been. So yeah, that's I would leave it at that.
Okay, and
Can you,
that's fair enough.
Yeah, and I think too, the new act that came out, something about safety in schools act or something. I'm totally saying it wrong.
the Bipartisan Safer Communities Act?
That
Yeah.
sounds right. And I think within that act, they had mentioned that they were going to ask CMS to update some guidance since the last guidance they provided, which I think was
Right.
in 2003. So I think that we're just really waiting for that before we do anything.
And I think that's really the case too. I was just hoping you guys might have had a little insight. I realize it's probably the wrong forum for me to send it to everyone on that chat. And I apologize for that. I meant to send it just to Olga. I didn't really mean to send it to everyone.
Yeah,
No.
you're welcome to put it there. You can also email me anytime.
Yeah, do you
or
want me to
give me a
put
call.
Do you want me to put a link in the chat so everyone can see what the heck we're talking about?
You can if you want. But yeah, again, we wouldn't, there weren't any directives towards us. Like Rose said, we're just waiting for the updated Medicaid administrative claiming guide to be updated. Like she said, it hasn't been updated since 2003. So that was part of that Bipartisan Safer Communities Act. There's also a lot of other guidance. I think something came out from NAME that essentially just summarized all of that section. It's like an 80-page document, but there's really only, I think, maybe 3 or 4 pages that are relevant to the program. So so yeah, and we'll see what they say about parental consent on there as well, and just go from there when they send out those details.
Okay. Well, thank you, Olga. I appreciate you addressing it.
Yeah, anytime. And like
we-
I said, you're welcome to reach out to me separately as well.
I will. I apologize for taking up your time.
That's
Please
okay.
continue.
No, it was addressed in the in-person trainings as well. So
Okay.
Yeah.
Thank you once again. I'm going to go back on mute.
okay. So let's talk a little bit about the admin claiming percentages. So these are different, right, than your direct medical percentages, because your admin percentages are providing you reimbursement on your quarterly cost reports. So this is those outreach and administrative type activities that your support staff and some of your direct service folks are providing. So what you're looking at here is it is broken down by quarter. Of course, your MAC claims are reimbursed by quarter as well. So these align directly with those. Your direct service cost pool is down on the bottom with your dark blue line there, and then your lighter blue line at the top with the administrative line there. That's your admin cost pool, your admin personnel, I think we call them in the system. So you can see a little bit of fluctuation there as well with the pandemic, which we've noted. If you recall in AJ20, I didn't mention on the last slide, but it's the same situation. We didn't actually have a time study in AJ20. We had the emergency exception for when the pandemic first presented and we weren't sure how to proceed. We sought guidance, or the department, I should say, sought guidance from CMS and submitted the emergency exception, which was granted. And so that row there is the average of the previous 2 quarters. So again, when you're looking at AJ, we did have a time study in AJ21 and then AJ22, but AJ22 a little bit different. That wasn't an actual time study. And in the AJ22 quarter, again, preliminary, those are not set in stone. We're still reviewing those. But that being said, for the admin cost pool, we did see a little bit of an uptick. So that is some silver lining here. We do think that the decline since the start of the pandemic, really in OD20 for the time study, right? Since we didn't have that AJ20 time study, we do think the decline is in part due to the emergency, I'm losing my words for it. It's the emergency plan, state of emergency, I'm sorry, in the state. So with the state of emergency, nobody was disenrolled in Health First Colorado. So naturally, it would make sense that you could see a decline here in that light blue line on the top, where you you see less outreach and administrative activities, and the bottom line for that matter. So a little bit of an explanation there on why the numbers look the way they do. But again, as we start to bounce a little bit back to normal, hopefully we start seeing the uptick happen, although we are still in a state of emergency. Okay, switching gears just a little bit. We want to talk about moment response, rejection, and follow-ups. Just because we do still get inquiries about this, probably more from your participants than we receive from you guys as coordinators, because you pretty much know what's going on with the moments and follow-ups and things like that. But nonetheless, we wanted to give you some data to share. So as you can see by the graph on this slide, you guys are really doing a great job. I mean, the majority of your folks are not receiving follow-ups. So we know that probably the loudest ones are the ones receiving those follow-ups, asking, why am I receiving these? Or what does this mean? I already answered this, but really they're not the majority. The majority are answering their moments in pretty good detail and not receiving follow-ups. So that's great. The remaining, not counting the no responses, of course, but the other ones that receive 1, 2, and 3 follow-ups, I think they make up less than 30%. What is that, like 28% or something of your participants are receiving follow-ups. So great job in educating and letting them know, what those are and how to answer with more detail, because that's paying off here. And we're going to be doing an activity here on follow-up, so we'll get a little extra insight there as well. Okay, moment schedule. This is just a reminder. As you guys know, when we implemented free care back in OD20, the notification schedules for moments did change. So we do like to just remind you, we know that you're well aware that you don't have 5 days to respond anymore. But also we don't have 5 days prior notification. Your participants are getting prior notification at that top schedule. So they're getting it 24 hours in advance, 6 hours, 1 hour. And then again, they're getting it at the time of the moment with their link to go ahead and answer that moment. So there are several prior notifications that go out as reminders. Then you've got your overdue reminders. So if your participant does not answer within the first 12 hours after that moment in time, they will get an email reminder. They'll get another one at 24 and another one at 36 if they haven't answered them. And as you know, when you set up your participants on your staff pool list, you do have the option to select yourself or add yourself to be copied on any of those overdue reminders. And a lot of you do that to help manage those moments and track down folks who aren't answering timely. And then follow-ups we just talked about, they're sent as necessary. So as we receive them, if we don't feel like we have enough detail or the right details, we will follow up and ask them another question on that same moment. And we can do that up to 3 times, depending on, if we're getting what we need in the responses. Okay, so with all that follow-up talk, that is going to bring us to our first activity. So Tracy's going to put us in groups and the facilitators have some questions. We're going to go over 3 different follow-up scenarios and we're just going to talk about them in a group and discuss, and then we'll come back to the larger group. I'm sorry, Rose was on mute, but I'm back now. Can you see the new PowerPoint or the rest of the PowerPoint up there?
Yes.
Okay, perfect. All right, how'd we do? We do okay with that one? Hopefully everyone got those correctly, and hopefully we could shed a little bit of light on that percentage like I showed you in a couple slides ago. Those people who are getting follow-ups, it's not always necessarily that they're just not giving us enough. Sometimes they can even be giving us too much, and we have to figure out what it is they're actually doing, to properly assign those moments to the right activity code. So hopefully that'll be useful for you when you train this upcoming school year. Excuse me. Okay, so moment justification reminders. We're just gonna press on with the RMTS update. So this is just a reminder You guys all know that you now perform the moment justifications using the claiming system rather than emailing PCG and us justifying those moments for you. So that's a big improvement. We felt like that was very necessary to do when we got the shortened response window on moments, because us being the middleman just sort of prolonged us getting those moments justified for you. Now, as soon as you find out you have a participant that was on some sort of leave, you can go into the system, find the moment they were assigned to when they were on that leave, and go ahead and mark it that they were not working and that it was paid or unpaid. So just a couple things that you do want to do as reminders is you want to try to justify the moment within that 2-day response time. We know that sometimes that can be hard because you don't always know in advance. I would say the majority of the time you don't know in advance when someone's not going to be there. You find out when you're trying to track them down. You're getting those overdue notices. Somebody's not answering their moment. You've tracked them down and found out, uh-oh, they haven't been at work. Now you need to find out whether they're on paid leave or unpaid leave, and that's a whole nother extra step. So it is ideal for you to be able to do all that within the 2-day response period. However, if you do find out, you know, a day late or something where you just were waiting on details, just email us and let us know. We might be able to work with you as long as the department approves us justifying those. But we do know that's quite a tall task, especially for those of you who are managing hundreds and hundreds of folks on your staff pool list. Also, we do want you to allow the participant to answer the moments when they return from being out when they received a moment. So for example, let's say I was working Tuesday, and then Wednesday I stayed at home because I had a sick kid, and then Wednesday unfortunately I got a moment, but I returned on Thursday. Everybody was great, went back to work. I can answer that moment on Wednesday. I just have to go in there and answer it and say, nope, I wasn't working that day. It was, you know, paid day because I was just took a PTO day or something like that. And that's perfectly fine. So you only want to justify the moments when the participant was not there on the day they were sampled, and they continued to not be there all the way through the response window. So that's key. Let's see, some of the don'ts we kind of touched on. We don't want to sit on people when we know that they are on leave as far as getting the information into the system again, because we're under that time crunch with the 2-day response. And I think we covered everything else. So send in any questions if you have any about justifying moments in the system or just the general practice. So it is pretty easy. We're just going to show you in a couple of screenshots here how you can go in and justify a moment. We know that you haven't done that probably since the AJ quarter. So this is just a quick reminder. When you log into the system on your landing page, you'll see on that green ribbon bar at the top of the claiming system a moments option. When you click that, you'll see your whole list of moments, the people with moments assigned to them on their days, and you should be able to locate your folks who haven't answered because there's a designation there saying they didn't answer their moment. So you can find them there. You can select from the list, which you'll see in that bottom step 2 piece. There's some sub headers down there above your list of moments. And one of them is action. When you click that little wheel with the drop down caret, you'll see the no work option. You'll also see the notify option there that it's kind of covered with that circle, but the notify, that's what you would select if you wanted to resend a moment to somebody who just maybe deleted it or missed it. But for the no work feature, the moment justification, you would select that, and you would get these couple of questions asking were they paid or unpaid, and then just, you know, to confirm that what you're submitting is accurate. And that's it. That's as easy as it is to just get that moment justified for somebody on leave. Very fast. So we did just complete the AJ quarter with compliance percentages. You should have received those. We just wanted to follow up at the end of the year when we're done and just talk a little bit about how we come up with those compliance percentages. So as you know, we do not count the invalid moments against you. So we know life happens and sometimes people leave in the middle of a quarter and you have to vacate them. Any moments that have been assigned to those positions on your staff pool list where people have then vacated those positions, those do not count against you. We still do get some calls every once in a while, not a lot, just saying, oh, I have a moment coming up and there's nobody in it, it's a vacant position. Can you keep that from happening? And the answer is no. Those moments are all generated prior to the start of the quarter and they're assigned to all the positions on your staff pool list prior to the start of the quarter. So as you move people in and out of positions on your staff pool list, the moments, don't change. They're assigned to those positions. So what you have to do is just wait for us to justify those vacancies and just rest assured that they are not counted against your return rate compliance. Also just want to mention that the 85% minimum compliance rate is 85% because it is a buffer, right? Sometimes you have somebody who is at work, they get sampled, they leave without answering it. Maybe they intend on answering it the next day, which is totally within the response window, right? But then life happens and they get COVID or something and they test positive in their home and now they can't answer that moment. That unfortunately is a situation where it would just be a no response. But that's why the minimum compliance rate isn't 100%, it's 85, right? Sometimes those things happen and they're out of your control. You just want to try to manage as closely as possible and act swiftly in the other situations like justifying moments and educating participants on answering quickly. That's all you can do. Sometimes there will be moments that go unanswered. Okay, switching gears just a little bit to talk about marking your calendars because as you know, the staff pool list is open for OD22 and we do want you to get in there and certify those calendars. So this slide matches up those colors right to the claiming system, what you're going to see when you log in there to update your calendars. We've got the holiday non-work days in red and then the snow day and the unplanned closures in that light green. The holiday non-work, pretty straightforward. You have a holiday coming up, you're getting ready to populate OD22. That means that you're going to probably mark your holidays for Thanksgiving and then the longer holiday season around Christmas. Those things will be marked. They're in advance planned on your board certified calendars. And so you'll want to mark them there. And you can do that ahead of time. They're holiday non-work, they're planned, right? You know in advance they're on your calendar. The snow days on the bottom are unplanned. Those are unplanned closures. You can't possibly know prior to the start of the quarter. So that's what you're going to utilize as those days pop up in the middle of a quarter. Your participants will still, if they're assigned to moments on those days, because those moments are assigned prior to the start of the quarter, remember? So if you do have folks that are sampled on a day that you marked snow day, they would still be required to go in and answer them when they returned from school, and they would answer them and say, no, that was a paid day off. It was we had a snow day or whatever the case, but they can still be answered. So every day that you mark a snow day extends the response window so that when you do return to school, folks can get in there and answer them appropriately. Okay, so this is just a little snippet of what you see in the system. So you have two different views depending on when you're looking at your calendar. So as you guys know, we look at different quarters, or you're working in different quarters all the time in one period of time. So right now in August, you're working on your OD staff pool and calendar updates, but you also just finished in August, or maybe it was the last day in July, your cost report for MAC for AJ 22. And then also you're working on your fiscal year 22 annual cost report right now. or hopefully you are. So there's a lot of things you're working on across different years, different quarters in the system. These calendar options are shown differently depending on what quarter you're working on and where you are in the quarter. So the top option here is what you see right now when you are going in there trying to update your OD22 calendar. That's what you're going to see, that top view. You're going to be able to mark things holiday non-work. You're going to be able to mark your teacher early release days, which is just to help you match up with your calendar, but they'll still get moments on those days. And then the bottom view here on this page that you're looking at, that's the view that you see once a quarter has started. You're in the middle of a quarter, right? Now you can't mark something as a planned day off because the quarter's already started. So now it's an unplanned day. And so you will see a different option here, and that's where you'll see those unplanned closures as an option. Okay, switching gears again a little bit to some new providers we have, new provider information, I should say, as well as new providers in the next couple of slides. So your school psychs, as you know, we added school psychs back with free care implementation in OD20. However, the requirements are what you're looking at on the left-hand side of the screen in the blue box, and you can see the effective dates down there at the bottom. So previously, when we first implemented, they required a master's degree or higher. They also had to have that endorsement for psychology, and they also had to be practicing under the supervision of a DORA licensed doctorate level psychologist, in addition to those other requirements at the bottom there. Current credentials, including the NCSP. So all that being said, those are in the past. Going forward with OD22, the new requirements are going to be here in the yellow, and you can see that the supervision piece has been lifted. So that's a big win. I believe since the implementation of school psychs back in OD20, I believe the department has been working on getting the revisions to these new requirements since then. So it has been a long time coming, but it has been done. And now going forward, they do not require the supervision piece. They do require that license from CDE as a special services provider with the endorsement of psychology, and that current credential must include the NCSP administered by the NSPCB, that's hard to say, or Praxis. So those are the new requirements. I do want to point out the effective dates on the bottom, because you have comprehensive reviews coming up probably in the next month or two. And the requirements, if you get school psychs selected, is going to be the previous requirements, right? Because that was the requirement during the time we're selecting. So going forward for OD, what you're updating your staff pool list with now, it's the new requirements, but for the comprehensive reviews, it's going to be the old documentations that we're requiring to review.
Rose,
Makes sense? Do we have any questions in the chat? Yep, sounds like we do.
can you hear me, Rose?
Yes.
Okay, this is Naylene, Douglas County Schools. So the new requirement, when it says and credentials include NCSP, is that the NASP or is that something else? Because I was under the understanding that if they pass the Praxis test, that entails them to get the CDE with the endorsement of school psychology. So I'm confused about the and on the extra credentials.
Yep, we had this question come up in training in person this last week. So I believe, and Shannon, Olga, correct me if I'm wrong here in restating, but I believe what Shannon stated was that this language was pulled directly from CDE's website and is the requirement from CDE. So that is why it is written that way, and it is.
So do they
still
need a
and.
NASP? Do they need a NASP?
What is the NAS? You're talking about an acronym that's not on this list, right?
Well, I know it's similar to the NCSP, I believe, but and maybe Olga can help me with this. I'm not sure, but I mean, all of our school psychologists have a CDE endorsement of school psychology. They cannot be in our district without this. Okay, so I have downloaded all of their CDE licenses. They're all endorsed with school psychology. What's throwing me off is the and. So do they also need a NASP credential, or I'm not sure what this NCSP is, because maybe I gave out the wrong information to our mental health leads, that we thought that if they were CDE endorsed, that means they passed their praxis. And I am not understanding the NCSP or the NSPCB.
Naileen, I would recommend going back to that email that I sent out when the licensure requirements were revised and we took that supervision requirement off, because it includes a link that goes straight to that CDE website that Rose was talking about. And I think there's actually a link on that NCSP and it'll take you straight to that website.
And this is where we can put in everybody's names and we'll find out if they have this credential. Is that correct?
I can't talk to that. I would just
because when I was talking to other coordinators, school coordinators in the district before I started the roster, they, we were all under the impression if all of our school psychologists have a valid CDE license with endorsement of school psychology, that means they pass their praxis test, which would entail them to be on our direct service pool. So if that's incorrect, because I like I said, I spoke with two different coordinators on this in two different districts, and that's what they're under the impression of as well. So if something's changed and there's another website, I need to go through each and every one of our school psychologists to see if they have this certain credential. I mean, I'm looking at what was sent to me just now from Omar, and I'm not seeing any place for any kind of credential.
Naileen,
Yeah, sorry. Go ahead.
Sorry,
Omar.
Olga, I didn't mean to interrupt. The link that I put on the chat is for the endorsements page. So if you go down, especially with the anchor that it has on the URL, it should take you to the SSP section. There's that section for school psychologists. And it does say, you're correct, Praxis or the NCSP certification. If you click on the NCSP certification, it'll take you to NASP. So maybe that's where the confusion.
Yeah, and that's why I mentioned that link that's on there to just really look at the communication that was sent out. And I would just really encourage, especially when there's a licensure change like this, any school district that has any questions, just reach out to us, reach out to PCG, and we're happy to answer any questions.
Yeah, I may to get a little bit more clarification on this.
Yeah, I'm happy to answer those questions. And again, PCG as well as you're working through those staff pool list changes. But yeah, at this time, it is that CDE license and one or the other there, that NCSP or the Praxis. So yeah, I just go back to that email and it's in there, but again, happy to answer any questions.
Okay.
Okay, well, that's not the only change we have to JobCats. So let's talk about those here. We've got 2 new job categories that you should see right now in your OD 22 quarter if you've been in there updating. And that is your board certified assistant behavior analyst. So it's the BC little ABA. And then you've got your registered behavior technicians. So these were not previously on your staff pool list. They are now also included in the covered services section of the program manual in section 2, and then also in appendix 2, their qualifications. And so these are the qualifications here as well. So this is the difference that you need to know when you're updating your staff pool list. So previously, you had ABAs as a job category, so applied behavior analysts. Those were board certified providers. Those have been changed to BCBAs. Just as far as keeping it very clear as to what the certification was. So the ABAs are now just called BCBAs. They still need that graduate level professional in behavior analysts, and they can practice independently, and they can provide supervision to the other 2 new job categories that we're adding. So the BCBA is not new, it's just a name change from the ABA to the BCBAs. And then the 2 new ones are the ones to the left of it here on the screen. So you've got your RBTs, who are more like your paras behavior techs as far as their credentials required, not much. But they do, we have heard from you that you have them at your district. So that has been added. And then they do also have to work under the supervision of a BCBA, as well as your board certified assistant BAs. So these are folks that do have a 4-year degree, but they don't have their master's in it. And they also do require that supervision piece where they have to be under the supervision of the BCBA. So make sure when you're going in there and looking now, when you're updating, that the folks that you had in your ABA category are definitely qualified to be there, because that is now the BCBA too, even though the requirements didn't change, the name changed. Make sure they should be in there. And if they don't meet the requirements, make sure you put them in one of these other, appropriate categories as they are. Any questions pop up about any of the new job cats before we move on? Nope. Okay, we're going to move on to our final activity, which is your staff pool list update activity. So again, Tracy's going to break us out, and you're going to work with your facilitators.
We can see it, Rose.
Great. Okay, well, we just have a couple of reminders left. Hopefully everyone found that those group discussions helpful. So want to talk about some important dates. I did mention that the OD22 staff pool list and calendar is already open. It opened on the 1st of the month. It is due on the 31st of August. So hopefully you're working with all the departments you need to make those updates. And then also this year for the JM23 quarter, your staff pool list will open again in November, and you'll have the month of November to make those updates and certify both your calendar and staff pool lists. And then just want to remind you about the trainings that we have for resources. We will have a fall refresher training for RMTS. It'll be recorded so that it can be accessed later in the year, but it will be somewhat of a system demonstration on how to do some of the basic things that are listed here under those topics. So updating your staff pool list, creating a vacancy, updating your calendars, notifications, managing your moments and shifts. So just a lot of good reminders with, the start of the RMTS season, we'll call it, up and coming. And then also we're going to be providing you with some additional quick little trainings, which we're calling click to learns. They're going to be less than 5 minutes, and it's really to help you navigate something very specific. We're going to run these recordings by the department. Once we get approval, we will send some notification out to let you know that they're up and available. But basically, let's say you forgot how to do a direct replacement. There might be a click to learn video that says how to perform a direct replacement. You'll see it's less than 5 minutes. You can click it, and it's just a quick demonstration in the system taking you through those steps. So just really pointed, helpful resources so that you don't have to go back and sift through or listen to maybe a 40-minute training to get that one little thing that you need. That is the intent of those trainings, so they will be up and coming. And with that, I think that we really conclude the program content. Always want to direct you to those resources, some of what I just listed, but really the School Health Services program site there that's listed under the department's website is super, super helpful. I mean, the manual that's listed there is broken down by each section. And if I would definitely say always start there. If you're looking for something, you'll likely find it. And then if you can't find it in there under that program manual as a resource, you can certainly reach out to us. PCG might have something supplemental, or we can point you to the claiming system. But some of the topics of information that you'll see in the claiming system are listed here. A lot of that is overlap in what you'll also see on the department's website. So really, we just try to put it as many places to try to get it in your hands as easily as possible. And then, of course, our contact information. So who to reach out to when. Also, I just want to mention that if you're in the PCG claiming system and you need help with something, there is a little help feature button that pops up in the bottom right-hand corner of your screen that acts just like an email. So if you don't want to open Outlook, craft a new email, that little web widget, we'll call it, will send an email directly to us, and it asks you for a bunch of important things to begin with. Like, is it RMTS related? Is it cost reporting? What are you looking to try to do? So that helps us get you your questions answered very timely and help you be on your way with whatever it is you're working on. So I think that concludes for the day. And I don't know if we had any other questions pop up that maybe we need to cover.
No questions in chat, Rose.
No questions, no worries. If you have questions that come up after, just shoot us a message. Also, don't forget the PowerPoints and recordings will be posted. I'm not sure when, probably soon.
I'm going to try and have the recordings posted to the website by the 24th.
Okay, there you go.
Hey, Rose, I have a really quick question.
Sure.
Got a little conflict going between, got a quick question, a little conflict, misunderstanding. On AIR's speech language policy path candidates, those are called CFYs, right? That's another acronym for them.
For being in their clinical fellowship year.
Yes.
I
get when I get things from people who hire things, they'll say CFY.
Mm-hmm.
And
that sounds right. That sounds
okay.
accurate. I mean, unless somebody else wants to correct me, but I'm trying to think back to how we have them listed in the job categories in the system.
Okay.
That sounds right.
All right. The other thing on the manual index, it says they need to, under the direction, supervision of a qualified therapist. So they do need to be supervised.
Yes.
Okay. So the person who is supervising them needs to be on our staff pool list to count. Is that correct?
No, you do not.
They don't? What about on when they are documenting in Easy EdMed? Is their documentation going to count?
That would be a question for your billing agent.
Okay. All right. Just
Yeah.
wanted to clear that one up.
Yeah, we would not require the supervisor to be on the staff pool list.
Okay.
But as far as how that works in your billing agent system, you would need to talk to your billing agent.
Okay, thank you very much.
Yep.
I have a contracted CFY that was being supervised by someone that's not on, we haven't hired her, so.
And I just put I'm sorry, I just lost my words, the provider qualification quick reference in the chat there.
Right.
And that does show in the SLP candidate category that they are in their clinical fellowship year.
Yeah, I just wanted to make sure because when I get information from within our school district, I get things, they call them different things. So,
Sure. Yeah, we know that.
yeah,
Everybody has their own
to
term.
be accurate. So
Yeah.
Okay,
Gotcha.
thank you.
Good question, Cindy.
Thanks.
Anybody else? Should we stick around for just a couple minutes, just in case anybody wants to ask? Thank you all for joining.